Hello everyone, this is Shadi Reis from Detroit Medical Center and this is SIF 22. With me is Dr. Sunil Rao. He is Professor of Medicine from Duke University and he is the upcoming President of SKY. Sunil, always a pleasure to see you and meet with you.
Yeah, thanks so much for having me.
Yeah, so SKY coming up in May and in Atlanta and we're going full in person.
Yes.
So tell us about it.
Well, we have a terrific program for interventional cardiology at SKY 2022. As you mentioned, it is going to be an in-person meeting in Atlanta. We're really excited about it. We've got all of the major topics and domains of interventional cardiology covered: coronary, endovascular, structural, quality. It's going to be the high quality meeting that I think people have come to expect from SKY. Tremendous number of satellite sessions, live cases. It's going to be a full bore interventional meeting, and I think we're all really excited.
It's long waited after 2 years of being
Yeah.
virtual. So how about fellows? Any specific session about the fellows?
Yeah, there are always sessions for fellows, and I think one of the appeals, I think, of the SKY meeting is that it's not an unwieldy meeting. If you're someone like me, I do coronary work. I don't do structural and endovascular. Right. I have time to go to those other sessions and learn about that. Same thing for the fellows. I mean, there's obviously a dedicated fellows program, but we encourage fellows to go to all of the sessions.
Right.
And in particular, I think the quality track is something that fellows oftentimes think, that's not really relevant to what they want to learn, because they obviously want to learn content.
Yeah.
But a lot of the fellows are going to end up being cath lab directors, maybe even chiefs of cardiology, maybe they'll be in charge of purchasing. So the quality track is going to be something very important for them as well.
That's great. So now we're coming back live. Anything new and specific about 22 session?
I think that we're going to focus a lot on is, shock is going to be a big focus, because that's obviously something that all of us are talking about.
Yeah.
I think that the chip space and the complex PCI space is something that we're all talking about. We want to get back into the swing of live cases and make sure that we're doing, showcasing educational content that way. So I think that, what really excites us about this is that, as you said, it's the first meeting in person after 2 years. Mm-hmm. And I think getting back into the swing of things is going to be really important.
Absolutely.
Not just for the society, but for the community as a whole.
As well, yeah. So I just want to shift topics a little bit to the PE. Yeah. During COVID, we had a big surge of PE,
right.
And I felt like interventionist has a big shift to focus on treating it.
Yeah.
So this has kind of led to a lot of innovation, new technology coming into the market to treating these patients. So do you think this is going to continue to be the thing that cardiologists treat?
I do. I think that, in the past, first of all, I think that PE as a disease state, or VTE, if you want to call it that, really we had a limited understanding of a lot of that. I mean, obviously, early on, the focus was really on diagnosis with the PIOPED trial. Then it was really about treatment with antithrombin therapy. Then we started thinking about lytics, and then obviously catheter-directed lysis. Now, of course, we have mechanical aspiration, thrombectomy, and it looks like that's a really attractive treatment strategy. To the company's credit, they have planned both registries and randomized trials. So obviously, we're a very data-driven field. We want to see the randomized data.
Correct. These
patients oftentimes are very sick. At least from an anecdotal experience, it does appear that these new devices help to lower pulmonary pressures, which theoretically should translate into a patient benefit. But I think we're going to generate a lot more data coming up. Yeah. And this is going to be a space that I think that interventional cardiologists certainly are going to play a huge role in.
Yeah, and it's good. I mean, I felt like they IR, vascular surgery, as well as CT surgery.
Yeah.
And the PERT team kind of start to come to the surface more.
Absolutely, and this is a lot like what we've seen with multidisciplinary approach to complex coronary disease, multidisciplinary approach to cardiogenic shock. These PERT teams really, I think, involve multiple different specialties: the pulmonary critical care physician, interventional radiology, cardiac surgery, and interventional cardiology. Right. Now, let's hope that it doesn't lead to turf wars, because at the end of the day, I think we have to make sure that the patient is the focus of what we're doing.
Absolutely. Well, Sunil, always nice to have you and get all the insight from you about SKY. Congrats for being the SKY President in 22. Please watch this video and others at the SIF YouTube channel. This is Shadi Reis from Detroit Medical Center. Sunil, thanks so much.
Thank you.